prices for surgeries, medical procedures, and medications should be standardized across the entire U.S. and selected by an agency in our government every year. I mean, I think, you know, surgeries and medical procedures and medications should be more accessible to people for sure. And definitely our healthcare system needs some work. And but I don't know. Our government should our government say this, guys?
I feel like it takes away from private organizations that put prices on medication, but it would depend on whether or not it's actually like affordable and accessible to all classes instead of just a higher class.
Especially those that pay out of pocket for their own medication, like for each visit. Exactly. So I don't think that government should entirely be in charge of that, just because they don't know the struggles of like having to pay out of pocket.
Well, after watching the Outsiders, we don't really know
exactly.
if the government does have some type of
control or say in it.
I do think they'd be better than private organizations.
Yeah.
So maybe if they had some work and more infrastructure.
This is a very broad statement, but it has some leeway.
Healthcare should be free and run by nonprofit organizations or government. I feel like, again, this is very broad, but I don't know if it should be entirely free, simply because we have such advanced technology and medication that other, I guess, like third world countries don't have access to. So they are going to be some sort of charge for it. I would say like it should be accessible more. It just shouldn't be entirely free, because then doctors and nurses and anyone in healthcare isn't getting paid for the work that they worked years for, or like they went to they got their education for. I don't think it should be free. It should be at least accessible depending on class level.
Somewhat equitable.
Basically.
The most important strategy should be maintaining high quality of services, not lowering cost. I do not think that should be the most important strategy. I think there should definitely be a part where they're both met in the middle, at least. Lowering cost is very efficient, but I know that's not possible with quality costs and everything. But, well, not possible, but it's not deemed efficient. But it is a possibility if you actually think about like who they're garnering to, instead of just like the productivity and the cost of everything. Because as much as like cost and stuff is important, if it's meant for people to get better and have healthy lives, I think that's more important than what goes into it.
Universal healthcare could be detrimental, or will be detrimental to the U.S. because it will lead to longer wait times and less quality care. So basically, in the U.S., it's well known that its bureaucracy is kind of compact, and there are too many people working in the government and bureaucratic organizations. So universal healthcare is definitely one part of it. So it will sort of lead to too many people working in the organization, and the efficiency is a bit low, and also people it's like there are too many sections of it, and also in the same procedure, so it may cause people to feel it's kind of lengthy to really get treated, and also because the process is a bit long for people to get their services, the quality cannot be guaranteed also. And also universal healthcare also signifies larger costs for the governments. So I think it will be inevitable for the quality of the healthcare to be really impacted. Thank you.
Healthcare companies are financially incentivized to find reasons to refuse patients' coverage. I think that's absolutely true. I mean, I don't know all the ways in which it happens, but definitely, like, just the healthcare system as a whole is just super like corrupt, I feel. And I remember I just have a lot of, when I think about like personal experience, like I've had some like family be in like nursing homes and stuff like that, and just like the healthcare system, just like it's so hard to like qualify for a lot of like help when like people are clearly in need of help. So they try to like really limit the or have like the strictest possible qualifications to receive assistance, and even then the assistance is just really like not good. So I would say I definitely agree with that.
The most important strategy should be maintaining high quality of services, not lowering costs. I disagree. I think high quality services at high costs means the healthcare doesn't get to the people it needs to in any way. The focus should be lowering costs but maintaining quality.
The most important strategy should be maintaining high quality of services, not lowering costs. I think high quality is important, but I think in order for it to be lower cost, I think that would get more people. You need to lower the cost so that more people can have access to it. So I think it should be high quality and low cost.
Universal healthcare would be detrimental to the U.S. because it would lead to longer wait times and less quality care. While I think these are valid statements, and there's no such thing as a perfect system, especially not a perfect healthcare system. In the U.S., so many people are scared to access essential healthcare services or unable to access them because of lack of insurance, lack of ability to afford things, and I think that these laws, like longer wait times, need to be taken on by the general public. And a lot of U.S. facilities actually already experience long wait times, and I don't think that is a huge loss. And when it comes to less quality care, the fact that people can receive essential care and basic care that they are not receiving, I think that is an extremely important benefit. So yeah.
Healthcare should be free and run by a non-profit organization or government. Well, I believe healthcare system is, in order to work well, it has to be funded. And if it is free, then the only people that can do that will be a government or non-profit organization. So if it's not supposed to be run by those people, my question then comes in, who is able to make it run? Because let's not forget the part of funding that will make it run, whether it comes to the quality of the healthcare, the access of it, all of it has to come down to the price, to the budget. And that can't happen without the support of those organizations that we know. In this world, without non-profit or government, I don't see anything else making anything possible or run without a capital aspect, especially in the US, those countries where money runs everybody's life. Healthcare system wouldn't work without that. So that's my specific opinion on this one.
Well, I know that many people are denied healthcare and people go bankrupt from it. So I think that we need to find a system that essentially helps fix it. But many countries do have universal healthcare, and while yes, it does seem like it's better, I wouldn't necessarily say that's the case because most people have to wait in line to get medical treatment, like even if it's like rarely, if they like really need it. Depending on the situation and time. So I think that, I don't know, it might be pretty difficult to actually have an actual efficient healthcare system. But if we were to spend more on healthcare, we'd have to raise taxes for it, which would also be a negative.
Healthcare reform is too complicated. We should leave things the way they are. I'd say our healthcare system is definitely not in a fantastic spot right now. And I think that when it comes to healthcare reform, there's nothing that could be too complicated about it to at least make an attempt to try and improve it. I think leaving things the way they are right now opens up a lot of challenges in terms of helping people, especially from lower income households or people that have less access to healthcare. And I think that our insurance system is kind of the basis of that. And I think we need to just keep making forward progress to find a way to make it more accessible for everyone. So I disagree that we should leave things the way they are. I think that there's no steps that are too small in terms of healthcare reform.
Healthcare reform is too complicated. We should leave things the way they are. I think it's too complicated for a reason. Things are always changing, and if we leave things the way they are, things will never advance in the way we need them to. So, yeah.
Universal healthcare would be detrimental to the U.S. because it will lead to longer wait times and less quality care. I disagree with this because at the current moment, healthcare in the United States already causes people to wait a long time, and for the most part, people are not getting quality care. If anything, universal healthcare will have more access to more people and get them to get what they need, regardless of the time at all. So, that's my take.
Universal healthcare would be detrimental to the U.S. because it will lead to longer wait times and less quality care. Well, I agree that it might lead to longer wait times and less quality, but I don't think it's detrimental because it gives access to everyone else in the country, so I don't think it's a bad idea.
Prices for surgeries and medical procedures and medications should be standardized across the entire U.S. and selected by an agency in our government every year. I agree with this because I don't think that some people should have privileges over others. However, I could see, like, if surgeries and medical procedures are quite expensive, I think there should be ways that people like lower income can access them, especially if they're necessities.
Healthcare in the U.S. is a privilege reserved for only the wealthy. I've gone months in pain to avoid high medicine costs. In terms of the second statement, I wouldn't say I've done anything that extreme, but cost is definitely something I think about, like even when I get hurt or have some minor ailment. But healthcare is a privilege reserved for the wealthy. I mean, that's probably true to an extent, I guess. I would say like everyone can have access to healthcare, but it's definitely easier for the wealthy.